Michigan DUI lawyer. Let's talk about the fancy eye test that cops love to use on the side of the road in DUI cases, the nagigmus test. Now, from your perspective as a potential defendant in a case like this, we don't care about the science. We don't care about its accuracy. We care about whether or not it was properly done by the police officers. How are they supposed to be doing this? Well, for starters, if it feels like it took the cop forever on the side of the road to do this test, there's a good chance that the cop did it right. It will feel like an eternity. Technically, it takes 52 to 54 seconds to properly conduct a test. On the other hand, if it's done in marathon time, just quick as can be, there's a substantial likelihood that it was done incorrectly. So for the nystagmus test, what the officer will do is position a stimulus. What's a stimulus? It can be a finger, it can be a pen, or if you're fancy like me, it can be a fancy nagigmus detector, right? Anyway, 12 to 15 inches away from the subject's face, approximately, and then a little bit elevated, just above the eye level. You move the stimulus back and forth to ensure that the eyes track equally. You're also looking to see if there's equal pupil size and whether or not there's resting nystagmus. Just the person is just looking and their eyes bounce. If one of these preliminary medical checks fails, the officer will skip the test entirely, or at least that's what they're trained to do. Similarly, if a person has a glass eye or they're blind in one eye, you cannot do the test on that person because they only have one functioning eye. Once you clear these preliminary medical checks, then you will take the stimulus and you will move it out at a rate that takes approximately 2 full seconds out and 2 full seconds back. And officers are trained that you need to learn how to do this horizontally. You will get these disco fever, Johnny, whatever types of things, and they'll arc, they'll whatever. It needs to be horizontal, and they need to practice this. 2 seconds out, 2 seconds back to center, then you check the other eye, and then you repeat that process. Checking for the lack of smooth pursuit by itself takes 16 full seconds. They then move on to distinct and sustained nystagmus and maximum deviation. You move the stimulus all the way out as far as the eye will go, 4 full seconds. Then do the other eye. You then repeat the process. Another 16 seconds for the distinct and sustained nystagmus at maximum deviation. Finally, you check for the onset prior to 45 degrees. They're trained on what's a 45-degree angle. They need to practice this stuff in their class. Move the stimulus extremely slowly at a rate that takes approximately 4 full seconds to reach the 45-degree angle. If you see nystagmus, then you should stop and verify it. So 4 seconds out, if you see it, you hold it for a couple seconds. That's 6 seconds, right? Check the other eye, then you repeat that process. Now you see how we're past 48 seconds. We're up there in the 50 seconds range. That is when the test is completed. But they're also trained to check for vertical gaze nystagmus.